It is truly a privilege and honor for me to say a few words about Martin Shepherd on the occasion of his retirement after a very successful career spanning almost 37 years in NHS dedicated to patient care. Martin qualified from University of Nottingham in 1983 and worked in a number of London hospitals first before he moved to Nottingham City Hospital in 1990, where he worked up the ranks to become Deputy Director of Pharmacy. Martin joined our trust in 1995 as Head of Pharmacy Services. Additionally, he took on the role of Head of Therapy Services in 2000, and the title changed to Head of Medicines Management and Therapy Services in 2003. Following divisional restructure in 2013, Martin became Clinical Director of Pharmacy and Therapies, initially in Clinical Specialist Services Division and later in Integrated Care Division since 2017. I am sure most of you who have known Martin for a number of years would really find it difficult to describe in words what an outstanding clinical leader and a model professional he has been. I'm just making a very humble attempt to draw some of the significant achievements he has made for our trust. During Martin's leadership as Chief Pharmacist, our pharmacy services have made numerous strides and have always maintained an excellent reputation regionally and nationally. Martin and his wonderful team are at the forefront of leading many innovations in pharmacy and medicines management. We were an early adopter of automation in pharmacy and on the wards, introduced electronic prescribing, for which the trust is now reaping a lot of benefits. Likewise, introduction of prescribing pharmacist, dedicated pharmacists in the ward, as well as now we have an MHRA accredited aseptic unit in our department. Some of you may remember Hemato Oncology team won Team of the Year award in 2021. Martin's colleagues in pharmacy wish to let him know that he is streets ahead in terms of developing pharmacy services, having a clear vision and an insight to see to the root of a problem. They deeply respect him for his open door policy and considers him not putting above any tasks in the department. It is also important to mention that alongside being our Chief Pharmacist, he is also Clinical Director of Pharmacy and Therapies Care Unit and is deeply well respected in whole of adult therapy services in the same way as he is in pharmacy. They consider him always approachable and makes time for them. And under his leadership, therapy services have progressed immensely, such as expansion of the workforce, the training and development, introduction of 7-day services, and supporting the move to electronic records and subsequently to System 1. In case if some of you didn't know, Martin has excellent baking skills and is regarded as a star baker in his local circles. It is a little bit of grudge for me to Martin that I have never had the privilege of tasting his cakes because they are so popular they have never managed to reach the divisional team. His therapy colleagues also wish to let him know that it is always good to be part of a department where there are opportunities of cost savings from drugs, and they consider him as a very good drug dealer. One of his direct report wishes to say that in their opinion, Martin's biggest achievement for our trust is appointing him into the post. However, he also wishes to add in the same breath, Martin's biggest regret might be appointing him to the post too. If I may take an opportunity to share a personal memory, this happened almost 15 years ago, and Martin is unlikely to remember this. As a young radiologist at the time, I was trying to set up a cardiac CT service, and this service involves giving patients beta blocker drug to slow their heart rate. I was obviously requesting advice from a lot of colleagues as to how to go about it. And I would get a range of advice too, such as writing a large business case, talking to chief executive first, organizing a meeting with multiple people in the room, and so on. Anyway, as a starter for 10, I decided to chance my luck by writing a direct email to Martin. I got a prompt and polite reply from Martin, and it started, "Dear Anup," a short and sweet reply to my lengthy email, immediately authorizing me for usage of beta blocker drugs. Years have passed. The etiquette, professionalism, and proficiency that I observed then has remained timeless. And if anything, it has only become better with passage of time. We have worked very closely together, especially during the last 5 or 6 years in our respective roles. And I have learned so much from Martin, in particular to develop the skills to represent multiple clinical specialties at your disposal and manage the expectations. Martin is a very key member of our strong DLT. One of my DLT colleagues quickly tells me that whenever we have sent an email requesting a response or action, Martin is always the first to touch the button. And we all deeply thank Martin for that. Above all, Martin is a true gentleman, kind and compassionate, and is highly valued as a dear colleague to many colleagues, past and present, and I'm sure many others would have more wonderful memories and personal accounts to recall and share. Dear Martin, on behalf of all of us here and in the remainder of the trust, I wish you all the very best and a happy retired life. Thank you.